Um, Something popped up in some of my feeds and it said like AI. Do you think that we're competing with AI resumes? Because I'm just wondering, how do
I've
you
been getting so many
overcome,
questions. Yes, I'm
like, how
so
do you
glad
overcome that type of situations? Because I feel like maybe that's why I'm not getting at least an interview or consideration, you know?
okay, so how AI is messing up or not even messing up or just sort of making more noise. I think it might just make more noise for a while around how AI is being used for like resumes, cover letters, and screening. And right now I've seen some, like basically I'm seeing how AI is popping up on your screening questions where folks are sending me screenshots that show, hey, it's saying if I want to opt out of AI screening. They're actually giving me an option now if I'm okay with going through with AI screening or and that's like, oh, okay, you have an option now. The thing is, if you want to try to use Chat GPT, it's still not successful to the level that we need it to be because at the end of the day, you still need to feed it information. And as much as I want to give you all a template to feed it, it still comes down to you understanding the language of the company so that you can even carry a conversation in the interviews. When you stay tied to the job, which is the hired methods from the resume, the cover letter to your interview prep to the language you're speaking, that's how you nail the job. So for you to lean on ChatGPT to kind of keep doing these like systematic things, everyone keeps telling me there was all these errors, I still had to clean it up. So kind of you just end up in the same problem of putting your hands on it and not sure if it's going to help you. ChatGPT has only been around for a handful of months that folks are actually using it this way where we don't know if it's actually getting people jobs, right? Like maybe it gets you an interview, but I don't know folks that are like using it where it's like, I know cover letters are probably the most that I've seen it be a little helpful because the person was feeling like I just I needed just the cover letters really to be that maybe, but honestly, the way that I teach you all to do cover letters, there is a systematic way to do it, and it's actually much easier than, in my opinion, than Chat GPT. So it's, I don't know, I'm not really happy with how AI so far is kind of, I think it still needs some time, but at the end of the day, it's more for you to manage and figure out. It's still another step, and you're welcome to explore it. But I know that like with the screening, you're able to get through because you use the key terms. So whether they're using a manual screener or AI, however that AI is, the whatever they're using, they're feeding it the information, right? So they're still an end user, the company employer, the employee, they are feeding it with like search for these terms, search for this criteria, scan for this, weed out that, weed in this, right? So we want you to be weeded in, and the way you're weeded in is using again the terminology that we pick out. And it's heavily on the qualifications and it's heavily in the key terms of the bullet points, not the company overview, not the job description overview, right? That's what we practice. So I hope that answers the question of AI, like what do we do with it? But that's how I'm seeing it affecting just the hiring process. Either way, there's an end user, either way, whether it's manual screener or AI thing that they're doing, they're still using the job announcement. So you can rest assured in that.
Okay, got it. So much for that clarification.
Yeah, it's a lot. I mean, I've explored it. I think it's just, I don't know, I feel like it's a wrench. It's just a wrench in the process. If you introduce it, it's just, ah. Okay, I guess folks want to maybe do some job searching. Is that what I'm hearing, sensing?
Zoila, this is Laura.
Hello, hi Laura.
Just quickly off of what Allison and Angelica were talking about, and you were talking about volunteering. I know the fall is really a lot of conferences and things, and you could probably get some free conferences online that can help you with, continuing with your education, but just volunteering and working with local public health professionals. I know I was a program chair for the Connecticut Public Health Association's annual conference for 5 years in a row. And it was very invigorating, and you met so many people within public health in your field.
Yes. So you're just simply suggesting for more networking to attend
Yeah.
those local conferences? I agree 100%. Yes. Yes. Thank you for that recommendation. I think it's really kind of on the onus of you as an individual to find them, because they're not so, unless you're plugged in, like if you want to be, I know each state has their own association of public health, or at least most do. So you can find that, start there. But as much as you can subscribe and stay up to date with their annual events, annual conferences, but also there's like regional things going on. I encourage you to go to coalitions when you can find them. I think it just depends on how you're looking locally, and it's not always the easiest. But yes, conferences, love it. Allison agreed. Anyone else in Florida? I am the president. Oh, are you the president of the Florida Public Health Association, Allison? Is that why I get a lot of the updates? I know
I guess so. Yeah, I am. I also have done a lot of work with the South Carolina Public Health Association, and just as an FYI, they
Oh,
are looking for an executive director for SCPHA. And I also have back in July, I went to a training for president-elects, where I met a lot of the either president-elect or president of the state affiliates, and would happy to make connections where I can.
I love it. No, I've sponsored the Florida Public Health Association conference, but I didn't get to attend. And I have my ears and eyes out for the annual conference, because I do want to attend Florida very
Well,
soon
I'm
when
really
I
glad to
can.
hear that. And actually, I want to talk to you about that. So,
We'll talk about it. Yes, we'll
yeah,
talk.
another
Okay,
time. But yeah.
another time. Yeah. Okay, great. Welcome. I saw someone join, Janet, I believe. Welcome, welcome. Oh, and I see a question about seeing these recordings. Kamal, is it possible to see it later? I was trying to figure it out, but couldn't see it anywhere. So I've been playing around with how to do this. I think when I record, I'm trying to keep it where you guys are anonymous. That way, if I put it, say like, I don't know exactly how I'm going to do it, but I'm trying to play around with YouTube a little more and the masterclass portal. So I don't know if I have enough bandwidth to like put weekly office hours in the masterclass. I feel like that's just going to be too much for everyone, but maybe do, whether it's like, if it's public, keep you guys private, or if I keep the link private, send it to the masterclass. So I might even do that, where it's like within the masterclass, here are all the recordings. So I'm still playing with how to house it. Worst case scenario, I may even just throw a Google folder in for everyone to have access to that. So it's been on my mind, like literally it's past due that I need to put a place. But again, I haven't been doing it too much because I want you all to come. Like it's best when you guys are attending and you get your questions out. And so I feel like it's also best when you kind of get, I don't know how many people will re-listen, I guess, but I'll keep you posted. It's literally in progress of like, how am I going to put these back up for you guys to listen to? So I appreciate that question. Janet, hi everyone, let's connect. Yes, please put your LinkedIn profile. Love it, love it, love it. Please connect with everybody. Connect with each other. I think we'll be okay to do some job searching if you guys want. Seems like baby's pretty content right now, so that's good. We're gonna go to story time, so she's nice and ready. So once we're done here, we just head out. All right, so you guys can see my screen. I'm gonna lower this. I'm gonna go off video. And then I'm gonna just go into my jobs. Sometimes I like to go into notifications first because there's some good, they haven't really sent me anything since the last ones I poked around. Some of the alerts I have are like strategy planning, 24 hours, US remote. So this is automatically sent to me. This one's pretty cool, but it might be family engagement and health team. Oh, cool. All right, so I try to teach you all to just jump to the bottom. What do they want? Public health, child health, family health, mental health, nutrition, research on disparities, a minimum of 5 years experience designing and executing health and nutrition systems in schools, maternal health. This is great. 85 to $100,000 job. As I is it Accelero? Accelero Learning, maybe? I think the last office hours, I was asked if I could post these on job alerts. I said I could, and then I didn't. I feel like if you want these, I'm sharing my screen so that you guys can grab them, write them down. The most I could probably do right now, again, I get busy throughout the day. I want to be able to do that. Best I could do is maybe put it in the chat for you all who show up, so that way at least you can grab it. But yeah, I've been doing job alerts once a week on Instagram pretty regularly. I hope to boost that up more. I'm looking at how YouTube, I can actually walk you guys through this a little more. So I'm excited to expand job alerts. Like I want to do them more than once a week, basically. I want to keep them going for you guys. Sometimes you just have to open them up. Sometimes they are obviously like IT or retail or business or another industry, but you just kind of have to go through it and just poke around.
Questions on that.
Hello. Yes.
Hey, it's Allison. Um, I feel like a lot of positions appear to be not the organization itself, but a recruiter, I guess.
Oh, a third party. Yeah. Yeah, that
Yeah, so
happens. That happens. That happens.
yeah, what is the best way to kind of navigate that?
So the question is about navigating recruiters or third parties that are posting on behalf of the company. And it happens. It's not like rampant, but it does happen. I've gotten us, I would say like two jobs, maybe one through that process, but I have experienced it myself and I've walked others through it. I think the biggest concern is so far I've seen as a mentee get scammed and wasting her process, but it was AI generated interviewing. There was no live, like for example, her interview was through a chat, right? So she thought, she's like, oh, I have to meet with this person, but there was no video, there's no like, so I think at the end of the day, you want to confirm there's a person, right? Whether it's a voice, whether it's a video, eventually you need to run into a person. And then you're welcome to look them up. Obviously, I've been using the Better Business Bureau much more. Not everyone is listed on the Better Business Bureau because it's just the nature of it sometimes, but at least you can see if they've been around, if they're legit, if there's any complaints from the public sent to that company. So you can still move forward. I think it's just making sure it's legit. Like, oh, okay, there's an actual agency, right? That's my biggest concern lately. Hold on, mamas. Does that answer the question? Okay, I'm back. Did I lose you? Are you guys there? Yeah, I'm here. I see that. Relief, philanthropy manager. Sometimes this is leaning on fundraising. So sometimes I'm weeding those out. Yeah, so this is substantial progress in fundraising. program manager, Privia Care Partners, statistics. This is a little more heavy. I think I posted this one just the other day. Yeah, this was on job alerts already. But if you guys missed it, I'll put it. It's really great. You do have to have experience with federal government contracts, but SME stands for subject matter expert. They want you to manage 2 subject matter experts. Okay, so is there a question? No. Can we also check for internships? Yes, Kamal, happy to look for internships. I mean, just real quick, if you look up intern. I don't think this one is an internship, but this is a good one. Check that out one out. I think some of these I've saved because I'm just always on here. Some of these I've saved, but I haven't actually posted yet. I was planning to, or I sent them to someone. I prioritize mentees. If you're interested in the mentorship, by the way, last day to enroll is today. I won't be accepting anyone until 2025. I'm going to just help the rest of the mentees this year basically look for work on a weekly basis. But if I send anything to them, I do not post on job alerts. So mentees, they're working behind the scenes basically with me. So I try to keep their stuff as private as possible. They have their own Google Drive with me, but if I send them something, you guys won't see it. So sometimes it's just sitting there. You know, I think I may have even sent this to someone and it's just sitting in my saved jobs because I saved it for her. So this is ICD coding. That's something else. If you guys are interested in some of you are still kind of figuring out that there's this other world of HMIT or healthcare management information system specialist. Talks about like coding and that. I would highly recommend Valerie. Oh my gosh, Valerie. Instagram HMIT. Oh my God, I follow her. I'll have to, anyway, I follow her and she's a great coach on, oh my God, what's her last name? It's escaping me. But she's like the queen of this. So if you want to work in that world, oh my God. Here's some intern stuff here, international growth intern. Internships are tough. I would recommend following a few companies, Kamal. Following a few companies. I know I have a mentee who's looking for an internship and she's been looking at private. She wants paid. She wants a paid internship, which is why she joined the mentorship. She's like, I want to maximize my fellowship internship opportunity. So I was like, let's do it. But she's been searching through the companies. So like Mathematica, Merck. She's like on it that way. So health equity, 24 hours. Health equity is being taken over by so many other industries. So just be patient if that's what you're experiencing. Anyone want me to search something? Last time I've been doing like maternal health, infant health. I could do like collaboration. Okay, I'll be on for like 2 more minutes.
Zoila, hi.
Yes, hi.
Afternoon.
Who's
Hi,
this?
it's Janet.
Hi, Janet.
I wanted to ask something about a PMP.
Yes.
What's it? The Project Management Professional Certificate, right? So when you're looking around at jobs that aren't necessarily entry level and maybe aren't necessarily technical, although some of the specialist kind of roles I've seen as well, a lot of them put the PMP kind of preferred or something. And I'm trying to figure out if the PMP is almost like something inevitable for someone to need to get in public health as you get a bit more senior? Because in South Africa or other countries, I really didn't hear about it very much. I'm just wondering
Yeah.
if it's a US thing because it's so huge, and do you have one yourself?
So
Does
PMP,
everyone remember?
no. So here's the thing with PMPs. I'm so glad you asked. So you can compete for PMP jobs for the most part, unless it's, say, like hospital level PMP, where so
Right.
usually people get it from Professional Management Institute is the organization I'm familiar with, and
Yes.
there is a cost to it. So that's,
Yeah.
I am a professional at helping you show up with what you got. So I never ask you to
Right.
get more. I don't believe that you need more
Right.
under your belt. So keep that in mind. I think you have enough of what it takes. It's more if your interest is in project management and that is going to be the world I'm going to just be in for at least the next
Right.
5 to 10 years, then I say do it. But if you have a background in, say, project coordination, program management, you've
Yeah.
been doing the implementation of the work, overseeing timelines, overseeing activities, making sure things are completed with the team, you know what project management entails.
Yeah.
It's more up to you to describe it in the world of that company. So sometimes they cite certain software you need to be familiar with. So that's more of their
Sure.
concern, like, can you manage qualitative data or quantitative data? Can you
Yeah.
handle statistical or numerical, right? Or like, what is that you can manage to in relation to their work? So I think the
Yeah.
PMP to me only is highlighted the most when it's healthcare. Yes, I see it in other
Right.
spaces like private consulting, but I see like project management rampant across all sectors. Maybe even
Yeah.
clinical trials level wants PMP, but there's other spaces like, for example, I helped my mentee get a job at the National, what is it called? National Council of Mental Health and Well-being.
Mm-hmm.
And that was a project coordinator or implementation coordinator for quality
Yes.
improvement, right? So that was a high level project management, but it didn't need a PMP. They just wanted to hear, how do you stay on top of a complex initiative with multiple stakeholders,
Yeah.
right?
Yeah.
So that is more of what, can you speak and demonstrate the soft skills as much as the hard skills, because a lot of you are stuck in the hard skills, and a lot of
Mm.
the guidance I'm still hearing from other coaches and even books in relation to the career of public health is they're still talking a lot about the hard skills, epidemiology and biostatistics,
Mm.
and
Mm-hmm.
even like health education roles where there's a discipline of health education. But what about all these other intermediary spaces, right, where you're talking about project management? You could be an implementation specialist. You could be a technical assistance advisor, right? These are a little
Mm-hmm.
softer skills, but it still is within the world of project management. So yes, you have what it takes, Janet, regardless of where you're located. You said you're in South Africa. Where are you located?
No, no, no. I'm in New York City, but it's just that
Oh, okay. I heard
compare.
that.
Yeah. So just comparing the fields,
Okay.
the
Yeah.
workspaces, but so
Yeah.
it is better that I'm spending my time on a course on R as opposed to doing PMP, right?
Yeah. So
Kind
R
of
is
thing.
cited, Python is cited, Agile,
Yeah.
Scrum.
Concrete things.
There's so much
Yeah.
out there, which is why I feel like it depends on your interests,
Yeah.
and just do your research on what's being cited so that way you feel comfortable. And a lot of it is comparable where you're like, well, I know Python, and they're like, okay, then that means you can learn
Yeah.
R.
Yeah. Yeah.
So just make sure you
That was my
understand
logic.
the equivalence.
Yeah.
Yes, understand the
Okay.
equivalence of those certificates. So I
Cool.
see,
Thanks.
Angelica, yeah, thanks for that question, Janet. I see that client relations was requested. I'm just poking through real quickly. I love that you want to search client relations. This kind of is used whether clients can either be like companies who are buying health plans, or it can be like a funded organization that they call the client, right? It could be, say, a consulting firm that's calling everyone a client in their job announcement, but the client is government, right? So I think the client relations shows up in different ways, but as long as you understand sort of how they're using it, then I say it's fine. Yes, you'll still see it as patients as well, patient relations. I see Cardinal Health post these all the time, patient support related jobs. Love it. Great role, especially if you want to get nationwide exposure. I think they give you like, I think you work camera attendance, mandatory camera attendance. So now they're trying to tighten up on all of us. All right, so copy. And I'm trying to do that too, y'all. I know none of you are on camera, but I am, because I'm like, you know what? I'm leading this. I need to get comfortable on camera more. Okay, thanks everyone. I know we're all jumping off, but here, if you have questions, thank you for joining. Thank you so much for coming to office hours here next Tuesday. I will try to find a way to put these recordings up. I'm working on it actively. And then when I do job alerts this week, which I haven't done, I will post as much as I can from what you guys saw. Okay, thank you. You're welcome. Hope this helped. Y'all are doing great. Keep showing up. Keep doing the work. All right, have a good day. Bye, everyone.
Bye. You too.
Bye.